And welcome back to This Week. I'm pleased to be joined by 6th District Congressman, Republican Congressman Diane Block. Always nice to see you. Nice to see you back in the district. I know you're glad to be back in town for a little while.
Always glad to be back in town and to be out in the 19 counties that I represent and just do everything we can to let people know that we want to listen to what they have to say.
Your constituents always want to hear from you. We appreciate your time with us. I know you're working hard and have been for several years now on the possibility of a balanced budget amendment for Congress. Tennessee has worked on a balanced budget amendment, balanced budget forever here in the state. It seems like a no-brainer. It is moving forward. Your idea has come out of committee. The Senate has now acted on it. It's getting closer. What is the possibility of this really taking place?
Well, we hope that there's a good possibility, as I was saying before we came on camera, that this is a really good thing for our House to pass a budget, the Senate to pass a budget, and then for us to get together and unify it. That is the way it's supposed to work, not these continuing resolutions. So we do have some things that are a little different. We will have a conference committee where we will make those match up, and then hopefully that will it'll go back to each of the bodies again for its final passage, and then it will go to the president for a signature.
How would this change how Congress operates in regards to, obviously we've continued to spend money that we don't have, there's debt that this country owes. If we have a balanced budget amendment, something's got to get cut or some more revenue's got to get brought in so that all those needs are met.
Well, our budget document actually puts us on a glide path so that we don't continue to spend more than what we bring in. It can't be done immediately because there are some mandatory spending that's the driver of the debt that you've got to deal with. And so it takes a little longer than what I'd like to and what my constituents would like to, but it does get us to a balanced spending within the 10-year window, and then we can begin paying off our debt. $18 trillion in debt and growing every year. We have got to find a way to only spend what you bring in or spend less than what you bring in so that you can pay off your debt.
That was my next question. If you get this proposal through and you get to a process where you are working on a balanced budget, you don't spend more than you bring in, can you then whittle on that debt that is just sitting there, the monster that faces our children and grandchildren?
And that's the goal. That is the big goal, because one of the things I say as I work in Congress, that I don't want to be 90 years old and saying to my grandchildren and great-grandchildren that here's what we left you. We were an irresponsible generation, and by the way, now you have all this debt to pay off. So that is a goal for us, is to not only balance it, to have that glide path where you really have your revenue match what your expenditures are, but also then to have enough money that you can begin paying off. And some of that means doing things like tax reform, where you can get the economy moving along and get more revenue coming in, so you can maybe do that even a little faster.
My understanding, one of the proposals involved with this would repeal Obamacare, the Affordable Care Act. You know as well as I do, as long as this president's in office, that's not going to happen. Does that endanger this process of actually happening with that being on this bill?
No, it does not. And one of the things that we will be doing, and it's a kind of a strange word, and it takes a little explanation for people to understand it, you can do on a budget document reconciliation, which is putting something on there. You can only do one time on the budget amendment. So in other words, you can't put everything on there, but you can do it with one item. And what that means is that normally in the Senate, it takes 60 votes to pass something. In a reconciliation, it only takes a simple majority. So we would have an opportunity for at least to attempt time to say that the Obamacare we know is hurting people. It's hurting folks that are employers and what kind of insurance they can give their employees, and it ultimately is hurting individual citizens and families. And so we would really like to have that messaging in our budget, that we'd like to begin to have something that's more market-based and more patient-centered.
If you get to a position, if the Republicans take the White House, where this may actually happen, does it need to be replaced? There have been some Republican ideas for replacing it, but they really haven't gone very far. The details are still kind of out there. Does there need to be something to help these people who don't have health insurance?
Absolutely, and that would bring us to the topic of the Supreme Court decision that will come down in June.
We're still waiting on.
And in June, if they do make that decision, that the subsidies that are being given to folks by the federal government in not having state exchanges, it would represent about 4 to 6 million people, and we are working on a plan where it would be a safety net, where we can move those people into the private sector insurance companies while also helping them with some premium support, and that would bring the cost down. It would also allow the insurance industry to have some more programs, different kinds of programs for people. And when that happens, you bring the cost down because there's more competition out there. And we're hoping that we'll have that document out so that the public can see what it is that we would do in a safety net for those that perhaps would lose their subsidies under the Supreme Court decision. And then they would know that something similar to that would be what we would do if we were able to repeal and replace the Obamacare.
I believe we're 5 years into the Affordable Care Act. Roughly 10 million people, they say, have signed up. How difficult does that make it to repeal or to replace when that number continues to grow that's in this process?
Well, that number really is a little uncertain, because when you ask the administration to give us those numbers, a good number of those folks are under the Medicaid already, and they count those in. A number of the people that are on that program had insurance previously, and they lost their insurance, so the number's a little hard to tell, but as you say, it's somewhere around 10 million. And we believe we have a program that would not only help those that are currently in the program where they're receiving those subsidies, but that we could also help others that are still looking for those opportunities where they truly cannot find insurance or be able to afford insurance.
You're back in the district. What do the folks in the district tell you is on their mind? What are you working on for these folks?
Well, Obamacare is obviously one of those, and what we hear from people is that I liked what I had, I couldn't keep it, and now my premiums have gone up, my co-pays have gone up, I've lost my doctor, I can't go to the hospital that I like. And so we're hearing from a lot of folks about the confusion also, even when they sign up for Obamacare on healthcare.gov. We get a call every single day, and that's what I want to do, is hear from people when I'm in the district so I'll know for sure. I also hear them talk about jobs and the economy and how we can get that economy moving. Wages are stagnant, and how we can get the economy moving again, and we have some ideas on that as well.
Congressman Diane Black, always nice to see you. Thank you for your time.
It's always good to be here with you. Glad to see you.
Stay with us as we continues in a moment.